Hi, my name's Chris Jacks. I'm the unit nurse educator here at the emergency department at Emory St. Joseph's. And today I'm going to show you how to set up for the A-line management. All right, so the first thing you want to do is make sure that you collect all your supplies. You're going to need a 500 cc bag of normal saline or LR. You're going to need a cable. You're going to need the transducer holder, the special transducer tubing. You're going to need a 500 cc pressure bag, and you're going to need the level. So once you get all your supplies and bring them into the room, you're going to, of course, check the patient ID, make sure you got that. You're going to do wash your hands, hand sanitizing, put on some gloves. Next thing you want to do is go ahead and set up, plug in your A-line just to have it out of the way. You're going to make sure that the red plug goes to the top portion of the monitor and where the pressure port is. Okay, next thing I'm going to do is I'm going to spike my bag of saline. This is the transducer's tubing, special tubing. Now make sure that your roll clamp is clamped off. Okay. I'm going to spike the bag just like you normally would. Fill up the drip chamber. Hang it on the IV pole. Okay, the next part is important that you do this correctly. You're going to want to prime the tubing from the drip chamber down to the transducer. There is a white cap that's on the clear cap that is on the stopcock. You can take that off, leave it open. You're then going to turn the stopcock off to the patient side, which if you're holding it this way, it's going to be to your left. Then you're going to unclamp the roller clamp. You're going to take and pull the blue pigtail until it comes out to this port. Okay, then I'm going to take the little white caps that come with it, and you have to put these white caps on because they do not have a hole in them. The ones that comes with have holes in them, so you got to put these on to close the system. You're going to make sure that your transducer holder is on your IV pole. Once you get it primed to the transducer, then you're going to put the IV tubing transducer into the holder with the pigtail going down like that till it snaps into place. Then the next step is I'm going to prime it from this port to the next port next to the patient. And by doing that, I'm going to turn the stopcock off to the patient end, just to the left here, remove that clear cap. I'm then going to pull the pigtail until it flushes out of that port. That might help if I turned it off to the port. Okay, I'm going to turn it off to the port and put my other white cap on the port. Then I'm going to flush it from that patient side port to the very end. Pulling the blue pigtail, come out. Now, if you haven't already done so, you can then put the pressure bag, and you can do this step when you prime the bag as well if you want to. Now I'm going to inflate the pressure bag before I hook this up to the patient's A-line, I'm going to inflate it, turn the stopcock to this opening here. You're going to inflate it until it gets to 300, which is in the green space. Okay, so now it's in the green, so I'm going to lock it. Now I can attach the end of the A-line to the A-line catheter. It's in the artery that the provider has already put in. And again, you want pressure so you can hold pressure against the artery. And you just connect it just like you would IV tubing, secure it down. The next step is you've got to level it and zero it. So this is where you're going to need your level. So what you're doing is you're going to level it, the transducer to the patient. So you may need to lower the transducer or raise the patient up. Either way, you want one end of the level at the patient's phlebostatic axis, which is mid-axillary, fourth intercostal space, which is about right here. So the patient would be laying supine or reclined. You're going to put it at their phlebostatic axis. And then you want the level to, the other end of the level is going to be at the transducer. Again, I can lower this a little bit. And then once I get it level with this middle bubble, I can then zero it. In order to zero it, you're going to connect the other end of this cable from your monitor to the transducer cable, like that. Then you're going to see an orange area on your monitor that says ABP or ArtLine, either one. You're going to touch in the waveform area to bring up the parameters. You're going to then, where it says 0 ABP, the first thing you have to do is you have to open this A-line to atmospheric pressure. The way that you do that, at the stopcock that's at the transducer, you're going to turn it off to the patient. So the way that this is the patient end, so I'm going to turn it up, off to the patient. I'm going to remove the cap. And then you can flush a little bit if there's a little bit of air. Now it's at atmospheric pressure. I'm then going to touch 0 ABP. It'll beep once. It'll give me a 0 in that parameter, parentheses, and it'll beep a second time. Once it beeps the second time, you have then zeroed it. You can place a new or a clean stopcock or a clean cap on the stopcock. Turn the stopcock back to off at the port onto the patient, and you should be getting a reading in your parameters. When you're transporting a patient that has an A-line upstairs, you cannot monitor them during the transportation. So when you're ready to go, you're basically going to unplug them from the A-line. You just unplug it, leave the cable in the department. You take and remove the transducer from the holder, because this is our transducer holder. When you're ready to transport a patient upstairs to ICU that has an A-line, once you get them hooked up to the transport monitor and you're ready to go, you're going to first unplug it from the transducer cable, leaving this cable here because you cannot monitor them in or out. Then you're going to remove the transducer from the holder. Then you're going to take your IV bag and just put it on you can use the stretcher IV pole, and then transport the patient, because anytime you move the patient has an A-line, like if you roll them or raise them up or down or whatever, you're going to have to re-zero it and level it. So they're going to have to do that once you get upstairs to ICU. They're going to, once they get the patient settled in, they're going to level it and re-zero it once they're settled.